Back at 8:14 this morning on Today's Consumer, we are helping you manage the soaring cost of prescription drugs.
Yeah, top of mind for a lot of folks right now. The list price on hundreds of medications is increasing this year with a typical hike of about 4%. The good news, though, there are some strategies to help lower those costs, whether you have insurance or you pay out of pocket.
That is good news. So here to show us how is NBC's Chief Consumer Investigative Correspondent, Vicki Wynn. Good morning to you.
Hi, good morning, guys.
All right, so let's dig in here. Let's start with how people can save, if you have insurance plans, how to sift through all of that and find the best deals on their medication.
Yeah, this is the perfect time to look at it because your deductible has reset, or maybe you're starting a new insurance plan, so you need to know which are the pharmacies that are in your network. You can check your insurance company's website. You can call that number on the back of the 800 number on the back of your card. Also, I want you to call your local pharmacies because although it doesn't make sense, sometimes it is cheaper to pay for your medicines out of pocket. Yeah. Even when you have insurance, you need to have that conversation and ask. And also go to the website of the drug maker. Usually there are some coupons, especially if you're starting a new medicine, that can help offset some of the costs.
Sometimes I've found at the pharmacy that they'll give you a coupon too.
Yes. Always ask.
Yeah, the pharmacist will give it to you.
That's a good tip.
What if you don't have insurance, Vic? A lot of folks out there watching, listening, they just can't afford insurance.
27 million people do not have insurance in this country, and that's probably a low estimate according to the most recent census data. That number is likely to go up this year because of the Affordable Care Act and the subsidies that have expired. And so what you do need to do is at the very beginning, when your doctor is prescribing you a new medicine, or you call your doctor now, or you go to the pharmacist and you say, is there an alternative that is as effective? Is there a generic? Is there something that is more cost effective for me? Don't be afraid to ask about that, because just like everything else, you have to negotiate the prices of your medicine, and you can shop around and you can find deals. It takes some work, but it's doable. Also, check out this website, GoodRx. That is a site that has a lot of coupons. It also allows you to compare the price of your medicine across CVS, Walgreens. If you're a member of Costco, you should definitely check with them because some of their medicine prices are low. Mark Cuban has this website. He's had it for years now, Cost Plus Drugs. It doesn't have all of the drugs out there, but if you can find your medicine there, the cost will be much, much lower. And then if you go to your drug maker, a lot of them have a direct-to-consumer cash price. For example, you know, AbbVie, Lilly, Pfizer. So you need to find out who makes your medicine and check their website.
That's good advice. And, you know, there's so much, I guess, in the news lately about healthcare policy.
Yes.
Can you sift through it for us? You know, like maybe what consumers really need to know.
Chanel, let's start with the good news, right? If you are on Medicare, you have seen the prices of 10 popular drugs go down 40 to 80% thanks to the Inflation Reduction Act. Things like Eliquis, which is a blood thinner, Jardiance, a very common diabetes medicine. So for seniors, that is reducing their out-of-pocket costs. Now, under the Trump administration, the president has announced his Trump RX website, and he's already negotiated some deals for those popular GLP-1 drugs like Wegovy and Zepbound to lower prices if you are paying cash. The website is supposed to launch sometime in early this year. We don't have a lot of specifics. We don't have a full list of the medicines that will be available. We talked with health experts who say, look, if you have insurance, probably not going to make a huge difference for you. But for someone who is uninsured or wants to pay cash out of pocket, you could see dramatically lower prices.
I mean, the reality is, Vic, like millions of Americans simply can't afford their prescription drugs right now. If you can't afford a drug and you need the drug, what can you do? What's your recourse?
Please don't ration those drugs, Craig. There are resources. So check with the local and state programs in your area. You do have to be proactive. You have to ask questions. You have to be an advocate for yourself. But there are also nonprofits and charitable organizations that will help fund those medicines that you need. Start at needymeds.org or go to fundfinder.org. Those are search tools that can help you figure out which organizations are available in your area. If you are in the hospital, for example, ask for someone called the Patient Financial Navigator. That is a person. Just be straight with them. I need help covering these medicines that I'm going to need when I leave the hospital. What can I do? And then finally, if you go to the manufacturer and you are underinsured or uninsured, they will also have programs that can discount or provide that medicine to you for free.
But I think you said something that
you have to qualify.
It bears repeating. Don't go without your drugs.
Don't go without your medicine.
Really quickly, last question. Can you get a better deal at one pharmacy versus another?
100%. It shouldn't be this way. Drug pricing is so not transparent.
I thought it was standard.
It is not. It is not standard in any way, shape, or form. So it behooves you to ask, to negotiate, and to sometimes ask about the different prices and shop around.
That's good advice.
Great tips.
Thank you,
Great
Vicki.
tips.
Hey, thanks for watching. And don't forget, you can catch the Today Show every morning on NBC or take Today when you're on the go. Just follow the Today podcast on Apple Podcasts, Spotify, or wherever you listen.